Howdy everyone, Matt and Mateo here. So I got a good response last week. People were asking, hey, what is a special test that you utilize in your clinic and with your practice? And so I thought I would talk about one for lateral epicondylitis. And as Mateo is dressed here, he's dressed like Maud. Did anybody ever watch that show? I used to watch it with my grandmother way back in the day. B. Arthur is hilarious. So this test, again, is for lateral epicondylitis, is how we typically learn it. Now, looking back through the evidence, it looks like it was developed in 1972 by Roles and Maudsley. And they were saying that it's a test for radial tunnel syndrome because when you do that resisted middle finger maneuver, it causes a compression of the radial nerve by the extensor carpi radialis. Later research, they were saying that the pain, which is the positive of the test, came from a disease in the extensor digitorum communicans muscle. So there's some kind of back and forth on it. Now, so how to perform said test? Have the patient extend their arm, palpate that lateral epicondyle, and tell them, don't let me push your middle finger up, don't let me push your middle finger down, hold that right there and push. And a positive test is they have pain right there in the elbow. A couple things I always tell students to really be aware of. Don't want to lead somebody with it to say, does this hurt right here when I do that? Or saying, do you have pain? Because it's leading them. I would just ask them, what do you feel? Some people say, I don't feel anything. Some people may have pain from me pushing. I could be pinching them when I'm holding it, so any of those things. But if someone says, ow, where do you feel that? And they say, oh, it feel that right out through here. Okay, that'd be a positive test. So what is the evidence on how good it is? Well, it has a sensitivity of 88%, but a specificity of 0. So this really says this test is really good for ruling out lateral epicondylitis, but it's not as good as for ruling in. And overall, looking at it, it seems like it's best if you kind of cluster them together with the Mills and Cozens. Now, how do I use it in my practice? So if a patient comes in and they say oh, I have pain here in my arm, I think it may be tennis elbow. And I'm like, okay, we're going to go through, of course, your history, your aggravating factors. We're going to get some baseline activities, but I will utilize it as a test retest because I found sometimes people that have pain through here may have something going on in the shoulder or the neck area. So if we get a positive with this, I may screen their neck, really move their neck to end ranges, and then we go back and retest this. And if the person says, hey, that doesn't hurt now, that gives evidence that it may be something else. That's how I utilize it. If we screen the neck, the shoulder, and it doesn't change this test, okay, it possibly is lateral epicondylitis, so we are going to treat that with whatever, that you would do for that. So there you go. That's the Maudsley test or that middle finger resistance test. Let me know. What do you think? You have any other things that you would like me to cover? How do you utilize this test in your clinic? So I'm very, very excited to hear of that. And like always, take care of yourself. Take care of your patients. I'll see you next time.